Welcome everyone to today's webinar. My name is Katie Stacy and I'm on the marketing team here at Realityworks. I'm here with Denise Bodart, our RealCare product manager. Denise has been Realityworks RealCare product manager for 10 years. She is a frequent presenter, trainer, and blogger for all things related to family and consumer sciences and health sciences. She has over 20 years of education, marketing, professional development, product design, and curriculum writing experience. Before I hand the presentation over to Denise, I'd like to review a few quick items. First, all attendees will receive a link to the webinar recording and a certificate of completion following today's presentation. Second, we have left time at the end for live questions. So if you have a question at all during the presentation, make a note and we'll be sure to answer it at the end. With that, I'm going to turn things over to Denise, who, for those of you who may have just joined us, is our RealCare product manager. Thank you.
Thanks, Katie. Hello and welcome to Shortcuts to Starting a Certified Nursing Assistant Pathway or Program of Study. Are you starting a brand new one or adapting your health science pathways or searching even for content to build courses? Well, today we're going to share some tools and materials offered by Realityworks that can help you jumpstart your pathway. We'll take a closer look at ready-to-use curriculum, presentation slides, and learning tools that apply to health science CNA programs. Here's a brief outline of what we'll be covering in our short time together today. We know that schools across the country are starting new CNA programs all over. And during this webinar, we want to walk participants through key concepts needed in these courses and show you how you can align tools and curricula that Realityworks offers to help you jumpstart your courses and perhaps make it easier and save you some time. Now, we're calling this session Shortcuts to Starting a CNA Health Science Pathway because, again, we're hoping that the information shared will help save you time as you do your planning. So here's a little bit about Realityworks if you're not familiar with us. We've been around for about 25 years. We're currently in 67% of school districts nationwide, but we're also an international company in over 90 different countries. But we are very active in career and technical education and health science being one of those areas. So you've probably seen us at a lot of different educational trade shows and conferences around the country. We're very active in that arena. Our products were developed with hands-on learning in mind. So we started with our RealCare Baby Infant Simulator, but we've now grown to welding, ag, and health science programs. We try to help teachers create these lasting educational and experiential learning programs. So today we'll be discussing just a few of our products, including the curricula that's included and how this content and these tools can be used to help build out several different health science pathways, but primarily that CNA or Certified Nursing Assistant pathway. So when you begin to build your Certified Nursing Assistant pathway plan of study, there are many places you can start and there are many resources you can go to. So let's begin and let's take a look at the pathways that pertain to the health science career cluster. Now, many of you probably already know that the 5 pathways within the health science career cluster are biotechnology, research and development, diagnostic services, supportive services, health informatics, and therapeutic services. And a CNA course of study falls squarely within that therapeutic services pathway. So as you begin to look at what you need in this area, a very helpful website to go to is on the slide in front of you. It's careertech.org/career-clusters. Now at this URL or location, there's something called a plan of study worksheet that is editable. And on the screen here is a sample plan of study for health science therapeutic services. Now you can use this as a planning tool to help you lay out the specific courses you're going to need in your health science pathway plan of study. Now we'll share some resources that can help you build out this plan, but first let's consider what makes an effective CNA program. Here are the 6 key elements for developing career pathways. These elements are important to consider for any pathway that you develop, including health science. So some of these, and these are cyclical, so they build on each other. So it's building those cross-agency and partnerships, identifying industry sectors and engaging employers. You need to be asking employers what they're looking for in their employees. Then you're designing the education and training program or plan of study around what employers are looking for. You're going to, of course, want to identify funding needs and sources to go to help get those resources that you need. And then you're going to align your policies and programs. Of course, that goes back to standards. And we'll be taking a look at many applicable standards today as well. And then how are you going to measure performance and know if your students are learning what they should. So as we go through the rest of the webinar, we're going to think about these 6 key elements and consider how you could use them to guide the development of any health science career pathway, especially the Certified Nursing Assistant pathway. One very helpful place to go to again is that cte.careertech.org and the Common Career Technical Course Standards for Health Science. Now they include specific measurable performance objectives for the health science career cluster in general, as well as each pathway within the cluster. So you could review these standards and the ones that apply to the pathway you're developing to ensure that you are teaching these basic core competencies in your program. And again, this is part of the 6 key elements where you're designing that education and training program. Again, I'm going to point you to that careertech.org URL, but this time /health-science. At this location, there are knowledge and skill statements for the health science career cluster in general, but also therapeutic services pathway specific knowledge and skill statements that are identified. And again, you can use this editable template that will help you develop all of the courses for your plan of study. Here's just one example of a knowledge and skill statement specific to that therapeutic services career pathway, which of course is where CNA programs fit. You can see that it focuses on effective communication. So if you're building a therapeutic service plan of study, do your courses include this type of content? Are you teaching things like patient communication skills in your courses? Later in the webinar, we'll show you how we can help you do that, just that and more with our content and hands-on resources. Now, involving your local healthcare industry leaders and clinical professionals in your pathway development is absolutely critical. How can you understand what local employers are looking for in a healthcare professional if you don't ask? Consider putting together a healthcare advisory council. Now, you could choose from a variety of settings and levels of responsibility to get a wide variety of viewpoints and input. Of course, we'd encourage you to meet on a regular basis, perhaps quarterly. And this, of course, could be in person or depending on where the people are coming from, could be via a phone conference, but have a very frank dialogue and ask, what are you looking for in your employees? And then you can ask yourself, does your course content align with what they're looking for in the CNAs that they hire? What are they looking for? So use your advisory council members to form partnerships. Are they willing to allow students at their location for field or job experience or even job shadowing? And are they interested in coming in to be a guest speaker in your class? These types of individuals can make terrific and interesting guest speakers. So engaging employers is again one of those 6 key elements for developing career pathways as seen in that earlier slide. Many districts require that any sort of career pathway created lead to an industry recognized certification or credential of some sort. Now, in order to find that right credential or certification for the program, you need to be asking questions like the ones you see here. Especially what specific criteria or experience do your instructors need to teach a CNA certification course? Is there a cost to it? All that kind of thing. Is that what local employers need your students to come out with in order to hire them? So if you are developing a new program, make sure you research and find out what to do so your students get certified properly. Now, all states do regulate nurse aides who work in nursing homes. This is also mandated at the national level. All states maintain some sort of registry. They also set standards for training and competency evaluation. Now, some set the training requirements at minimum 75 hours, some set it higher at 120, some even higher. So take a look at what your state mandates. CNAs typically have to take a test that requires them to carry out some sort of skills proficiency evidence, such as taking blood pressure, putting on compression stockings, patient bathing, that sort of thing. Again, think back to the 6 key elements for developing career pathways. Certifications and credentials are part of the step for aligning policies and programs. So where can you get a CNA certification currently? Well, per the U.S. Bureau of Labor Statistics in 2016, there were approximately 1.4 million employed as certified nursing assistants. Nursing care facilities employed the greatest number of nursing assistants at 37%, while only 4% currently work in home health care. So just where can you get a certification? Well, certified nursing assistants first must complete a state-approved training program. These are generally found in places like community colleges. They can be at high schools, vocational or technical programs, sometimes even on site at local hospitals or nursing homes. And again, some employers will offer on-the-job certification opportunities and pay for that training for their employees. The Red Cross offers an in-person class. Some vocational schools and community colleges offer online CNA programs as well. Now, many programs, operate from clinics or at local hospitals. There are pros and cons if you're considering, online certification. Some individuals may be able to get theirs quicker, but there's a concern that some of the skills training may not be at the same level as in class. So there's lots to consider for both formats. Most programs average roughly 4 to 12 weeks for completion, depending on the class and how often they meet. Programs are typically divided up between classroom hours and also clinical hours. So again, each state has designated numbers of clinical hours that individuals must complete before they can apply for their certification. So things to look into. Now here's the next few slides are going to be national organizations that you might want to reach out to or take a look at to see what they have to offer. The Red Cross is one of those. Now graduates of the Red Cross program are eligible to take their state competency exams, and if they pass, they can be listed on their nurse aid registry in that state. The state competency exam again includes most of the time a written exam and a skills evaluation. So the purpose of that state exam is to make sure that that these people understand and can safely perform in the role of an entry-level nursing assistant. So again, that may be one organization you could consider partnering with. Where can you find other types of certifications? Well, NOCTI, or the National Occupational Competency Testing Institute, has several different related certifications you could also take a look at. They have one in health assisting, home health aid, medical assisting, nursing assisting, and practical nursing. They also have one that's pathway specific called Therapeutic Services. They even get specific to employability skills. So there are many different certifications that you could also, in addition to just a CNA certificate, go after for your program. Another national organization is the National Council of State Boards of Nursing. Half of the jurisdictions or states in the national use the National Nurse Aid Assessment Program. Now this includes a written portion and a skills demonstration portion as well. And there's a link here that you can go to find out more about that specific assessment program. In the NNAAP assessment program, they do have a list of 23 specific skills that must be demonstrated in order to get that certification. Now, another national organization is the American Medical Certification Association. There's a lot of acronyms here, and I've put that website up there and their logo. So this association has many certifications available in different categories. The clinical certification area includes one that's called nursing assistant, which is probably the most applicable one for CNA type of program. So again, you can see there are many industry recognized certifications and credentials to consider as you put together your plan of study and your pathway program. Now here are a few other organizations that offer technical and or skills assessments that you may not be aware of. The first one is the National Consortium for Health Science Education, and it offers a health science assessment. Now, this is not a right to work credential, but it adds credibility of a national certification of achievement. It does satisfy Perkins requirements. It validates student mastery of foundational healthcare knowledge and skills. And there are also several benefits for students that go through that. First of all, they do end up with that nationally recognized end of pathway certificate. It will validate the skills that they've learned. It's a certificate that they can show in job interviews and also put on their resumes. And it's also something that would be recognized as they apply to good college programs. And it also may make it easier to articulate into college programs. Now, HOSA, that's a national organization you're probably very familiar with, but they do offer dozens of knowledge and skill competitions, both at the state and national level, relating to a wide variety of health science topics. They actually have 56 competitive events that are aligned to National Healthcare Foundation and accountability criteria. So they even have a nursing assistant specific competitive event. So we really highly encourage HOSA members to take full advantage of those national competitive events programs as a way to increase the knowledge and skills as they prepare for those future health occupations. So let's talk a little bit about curriculum. Now we know that curriculum forms the content backbones to any effective plan of study. What you teach is just as important as how you teach. Now think back to those 6 key elements. That's where we can help you. We can help you design your health science program plan of study, the courses, and help you with the content that you will include. We've got dozens of lessons from a variety of curricula provided with our experiential learning tools. We've reviewed them and put together a recommended package of content for creating several different health science pathways. We've got one for basic nursing, certified nursing assistant, geriatrics, and gerontology. So here is the content we have available, and these curricula or lesson plans are included with the Realityworks products that we're recommending for use in that certified nursing assistant plan of study. This is called a pathway package by us. It's the CNA pathway package. And each of these separate curricula integrate teaching soft skills, so those hard nursing skills are taught, but also the soft skills, patient empathy, communication with the patient, along with the specific nursing care skills. That's what makes our products unique in the market. We teach both the soft skills and the hard skills. Likewise, here's some of the content we have available if you're interested in creating a more geriatric or gerontology specific pathway as part of your CNA program. So again, all of these lessons and curricula do include slides, the facilitator instructions that are step-by-step. They include pre and post assessments, but again, each individual lesson does weave in the use of the simulation tool or experiential learning tool, but teaching the soft skill and also the hard nursing skills. So once you see the breadth of content that we've had in the last 2 slides that's available, now you can begin to figure out how to plug it into the courses you have in your plan of study. Remember from the earlier slide that had the list of courses in that template? Well, if you already have some of these types of experiential resources, you can begin to review curriculum topics included and see where they best fit within your pathway and your course content. Don't reinvent the wheel. The lessons are created by educators and for educators, and there are step-by-step instructions, assessments, and again, slides and ready-to-use activities. So anything you get from us will include all of that. So if you're looking for more specific to those soft skills, we do offer an employability skills program. It's a standalone program that teaches 20 different soft skills. Now the program can be used as a supplement to any career pathway program. Fits great into health science. Each lesson in it is a standalone lesson on a specific soft skill. So you could teach them all or pick and choose what's important to your pathway. The program comes with an instructor guide, student workbooks, and scenario cards. So if you'd like to significantly increase your soft skill instruction, this is a really, really easy way to build in anywhere from 15 to 30 more hours of content into your health science plan of study. So at this point, we'd like to share some of the hands-on resources we have available and that we recommend using for starting a certified nursing assistant or geriatrics, a specific career pathway program. So these are all the different ones that are the recommended simulators and task trainers that we have that provide students with that practical hands-on application of the content that they've learned. So here's where they get the hands-on learning, learning those transferable career skills, if you will, and foundational knowledge that they will use directly in their CNA careers. So for example, the geriatric simulator, you put it on and it simulates many common conditions of aging. Well, once your students have walked in the shoes of a geriatric patient, they will never treat their patients the same again. The same with the sensory impairment kit. They then experience what it's like to live with an essential tremor, what it's like to have hearing loss or hearing impairment. And they also learn what it's like to have moderate to severe arthritis. The geriatric nursing mannequin is a great starter simulator for teaching basic nursing skills because you can do things like ambulation, you can do things like patient bathing, and skin care, and many of the different things that they are actually tested on in their skills demonstration. And so that's just a very, very nice simulator to consider. We've got a skin condition kit with 9 different geriatric skin conditions, and these wounds can be put on real people or on mannequins. So you can create scenarios with using one or the other that will help your students learn to do a skin assessment. They learn to identify the skin condition, treat it, how to prevent it, how to chart it. They love those because they look so very realistic. Same thing with the pressure injury kit. We've got wound stages 1 through 4 and a heel injury, pressure injury wound that you can put on mannequins or on people. You can turn your patients into standardized geriatric patients, and they look very, very realistic. We have catheter trainers, male and female, and we recommend the vinyl because the vinyl torso has a a very realistic genitalia that they have to deal with for male and female. But they also, the vinyl torso makes them also have to deal with the legs and having to deal with that part of the anatomy when they have to do peri-care and cleaning around the catheterization area. And the blood pressure simulator is a great tool because you can pre-program any blood pressure that you want your students to have experience with. So you could make sure that they're not just practicing on each other and learning those healthy and normal blood pressures, but you can go in and edit it, and they could have to learn to take blood pressures for many different conditions out there. Again, for geriatrics and gerontology, we recommend many of the same simulators for the geriatric kit as well. We also do include some DVDs because some of these have some really helpful foundational knowledge in them, all about communicating with the aged care residents and being that providing the personal care and being a home health aide. So those are just some of the tools and the content that are recommended in our pathway package for CNA. So you've seen the variety of the resources that are available. Some, again, you might have some of these already. So if you already have some, we can identify the gaps for you of the things you don't have and help you build out the rest of it. But you can begin to plug these in now to the courses that you're going to have in your plan of study. And then you can see where the gaps are, and then you can fill those in. But when you have these types of hands-on learning tools, it really makes the content much more memorable, and learning becomes sticky for students. They will remember these experiences. Now, that's a lot of information to digest in a short time. So I guess what should you do first? Well, we would love to help you. If you'd like to give us a call and reach out, we could take an inventory of what you could tell us what you already have. We can help put together a pathway package that really speaks to your program needs. So the things that we've shown you today are suggested resources and hours of content that fit into a program of study like that, but we can do much more than that as well. So we just want you to know we're here to help. And this webinar was especially meant if you are starting from ground zero. If you walk in and you're like, I'm supposed to create a CNA pathway program within the next couple months or whatever, or for the next semester, if you purchase a pathway package from us, you get all of the 19 to 20 hours of content, you get all the simulators and task trainers and models, and you're ready to go. And it would give you a great starting point that you can add on to for years to come. So again, these are those pathway packages I was referring to. The CNA specific one is the one in the middle. And some of the slides that we showed you did list all of the simulators and the task trainers, and also all the content areas of the lessons. Again, if you're really wanting to focus more on the geriatric specific type of pathway, that's on the right. But again, if you have more of a broad nursing type of program, not just specific to that geriatric population, we do have a package for that as well, and that is on the left. And that really covers a great breadth of nursing hard and soft skills. So here's just a great visual from the National Consortium for Health Science Education that summarizes how health science career cluster leads to filling the skills gap that we have currently in health science careers. It begins with that awareness in the early grades. It gradually progresses to foundational knowledge and skills learned in high school, leading to specialized knowledge and skills in those 5 pathways learned through post-secondary coursework and in the workplace. So I thought this was just a great visual from that organization that I wanted to include. Certified nursing assistants will always be in demand. As that baby boom population ages, nursing assistants will be needed to assist and care for elderly patients. There is so much opportunity out there for students, and we have heard that from many of the teachers that we see at the state and national conventions. We see many more CNA programs coming to fruition at the high school level rather than waiting to start at the community college or post-secondary institution level. So if you find yourself, especially at the high school level, having to start a brand new CNA certification course, we're hoping that some of the information and resources that we shared with you today will make things go much quicker for you and provide some shortcuts for you. So at this time, I would open it up to any questions anyone may have on any of the things that we covered today. Again, you will be receiving a recording of this, a link to the recording if there's anything you'd like to revisit, or links that you'd like to have access to again. Seeing no questions at this point, I guess we would like to wrap up our webinar for today. Thank you for participating, and all the best of luck as you create your certified nursing assistant pathway.